Let's discuss about an autoimmune disorder called as Pemphigus vulgaris. This Pemphigus vulgaris is an autoimmune skin disorder which is characterized by the development of painful blisters and erosions of the skin as well as mucous membrane. And in this condition, the type of autoantibody seen is the IgG type of autoantibodies produced against the target protein desmoglein 3. And desmoglein 3 against antibodies are more common than that of desmoglein 1. And this condition, Pemphigus vulgaris, is seen to involve the mucous membrane also. But in case of Pemphigus foliaceus, mucous membrane is not usually affected. But in case of Pemphigus vulgaris, mucous membrane is also affected. And the types of blisters seen are the flaccid blisters are present. As these blisters are flaccid, bulla spread sign is positive in these patients. And even the auspice sign is also positive. And the auspice sign is nothing but when bulla is removed, we can find pinpoint bleeding spots are seen on the lesions. And this is the auspice sign is also positive in these patients. See the further in detail about the condition Pemphigus vulgaris. Pemphigus vulgaris. This Pemphigus vulgaris is the most common type of Pemphigus. In this condition, IgG autoantibodies are produced against desmoglein 3 more than that of desmoglein 1. It produces autoantibodies to both, but desmoglein 3 against antibodies are more common than that of 1. And it is an immunobullous disorder, and the most common age group presentation are the 40 to 60 years of age. And the patient presents with the clinical features like burning sensation over the raw areas, that is erosions. Flaccid bulla will be seen over the normal skin. And they also can develop secondary lesions like erosions. And the most common sites for Pemphigus vulgaris are the scalp, oral mucosa, chest, trunk and flexures. Pemphigus foliaceus is a condition where the oral mucosa is not involved. But in case of Pemphigus vulgaris, oral mucosa involvement is also seen. This condition clinically has Nichols sign positive, that is punctate bleeding spots are seen, as in case of psoriasis also. And bulla spread sign is also seen because since the bulla are so flaccid, bulla spread sign is also seen. And oral mucosa mainly shows painful erosions. Let's see the investigations which help in the diagnosis of Pemphigus vulgaris. Zank smear is used where the histopathology of bulla by skin is taken, skin biopsy is taken, and on direct immunofluorescence we see fishnet or chicken wire pattern. And the treatment that is available that can be offered to the patients of Pemphigus vulgaris is the systemic steroids. Even the cyclophosphamide also can be tried, but the side effect of the cyclophosphamide is the hemorrhagic cystitis by acrolein metabolite. And in order to treat this hemorrhagic cystitis, we use Mesna. And even anti-CD20 antibody is also tried in case of severe cases. And this antibody is the rituximab, is the anti-CD20 antibody which is used. The side effect of cyclophosphamide is the hemorrhagic cystitis, and this can be controlled with the use of Mesna. In case of relapse conditions, we use rituximab, which is anti-CD20 antibody. And this is in brief about Pemphigus vulgaris, and thank you for watching.